Okay, so get this. We're seeing these reports about like a possible HMPV outbreak
Well,
in China.
yeah,
And obviously the internet is kind of freaking out a little bit.
right.
This is coming just 5 years after COVID, so, you know,
Right.
it's understandable that people are on edge.
Makes sense.
We have a ton of sources to look at today.
Ooh.
Everything from news articles from Reuters and WebUI on to like social media posts
Okay, let's
on
know.
Facebook and X and even Telegram.
Wow.
So is this thing a real threat?
Yeah.
What makes HMPV different from the other respiratory viruses that we hear about all the time? And how does this connect to like everything that we learned from the COVID-19 pandemic?
Right.
So let's find out.
Let's do it.
I saw this one X user who was even claiming that China like declared a state of emergency because of this HMPV outbreak.
Really?
And there are all these like crazy videos popping up online showing overcrowded hospitals
Oh, God.
in China. Everyone's wearing masks again, and it totally looks like, the early days of COVID.
I can see why people would be freaking out.
Yeah.
It definitely makes sense that it would get attention, but
Yeah.
it's important to keep in mind that we haven't actually seen any official confirmation from China
Right.
about a state of emergency.
Yeah.
Or like a full-blown HMPV epidemic.
Okay, good to know. Good to know.
Yeah.
Before we go any further, though, let's just break this down.
Okay.
Like, what is HMPV?
Right.
One of our sources, Tex Calais, describes it as like a common respiratory virus that typically causes cold-like symptoms.
Got it.
But it can be more serious for certain groups, like vulnerable people.
Mm-hmm.
They also point out that there's no specific vaccination or antiviral treatment for HMPV.
Interesting.
So if this has been around for a while, why is everyone making a big deal about it now?
Well, Tex Calais mentions that HMPV was first identified back in 2001.
Oh, wow.
So
it's not new.
No, it's not new. But I think there are a few things that are sort of converging to put it in the spotlight now.
Okay.
Firstly, Reuters is reporting a general rise in respiratory illnesses in China,
Okay.
including both common cold, which is caused by rhinovirus,
Yeah.
and HMPV.
Okay.
And secondly, I think the world is just undeniably more sensitive to infectious diseases post-COVID.
Yeah, for sure.
You know,
That makes sense.
we've all been through a lot.
So are we seeing like a surge in HMPV cases? Or are we just more aware of it now because of our heightened, sensitivity to potential outbreaks?
That is the question, isn't it?
Yeah.
I think the information we have right now points to a combination of factors.
Okay.
There's definitely evidence of increased HMPV cases.
Yeah.
But it does seem like the situation is probably being amplified by anxieties
Right.
stemming from, our recent global experience.
For sure.
And YION even included a disclaimer about the difficulty of verifying many online claims,
Okay.
which I think just highlights the need for caution.
Yeah. It's easy to get caught up in the online frenzy.
Totally.
Like some people are calling these reports propaganda,
Oh, wow.
while others are weaving it into like conspiracy theories about political agendas or population control.
Oh, my gosh.
And then you have the people who are like genuinely worried,
Right.
especially those who remember like the COVID lockdowns and everything.
Yeah, I could see that.
That came with it.
That makes sense.
It's a prime example of how information,
Yeah,
particularly in like the realm of health,
right.
can become entangled with like existing beliefs and fears.
Totally. And this is why critical thinking is so important.
Yes.
And reliance on credible sources.
Absolutely. One Facebook user who claims to be in China even commented,
What?
I am in China and they are joking.
Oh, wow.
So there's a possibility that the online narrative is very different from like the reality on the ground.
That's so interesting.
What's your take on that?
It really highlights the need for multiple perspectives.
Oh, okay.
And, a healthy dose of skepticism,
Yeah.
especially when social media is involved.
Especially with social media.
Yeah.
Okay, so no confirmed state of emergency, but we know that HMTV is on the rise in China.
Got it.
Another thing that stood out to me was Tex Calais' explanation of how HMPV spreads
Okay.
through like respiratory droplets and contact with contaminated surfaces.
Oh, just like COVID.
Just like COVID.
Oh.
Does this similarity in transmission contribute to like
Yeah,
the current concern?
absolutely. I think it's natural to draw parallels,
Yeah.
especially since we're all still processing the impact of the COVID-19 pandemic.
Yeah.
But the question is, are those comparisons helpful?
Right.
Or are they fueling unnecessary panic?
That's a really good point. we do seem to be drawing a lot of comparisons to COVID.
Yeah.
What do you think? Are we more prepared now than we were 5 years ago?
That's a complex question.
Yeah.
With no easy answers. On the one hand, the global health community has learned valuable lessons from the COVID-19 pandemic.
Right.
Particularly regarding like surveillance testing and communication strategies.
Yeah.
On the other hand, though, there's always that risk of overreacting to new health threats.
Right.
Especially when memories of a recent pandemic are still so fresh.
Yeah.
The key is to strike a balance between vigilance and informed decision making.
Right.
Without succumbing to fear mongering.
Yeah, that's a good point.
Yeah.
Speaking of lessons learned, I was looking at another source.
Okay.
The Indian National Center for Disease Control, or the NCDC.
Right.
It seems like they're actively monitoring respiratory illnesses.
Okay.
Both within India and globally.
That's encouraging.
Yeah.
I mean, the NCDC's proactive approach is a testament to the heightened awareness and global collaboration that emerged in the wake of COVID.
Yeah.
They're not jumping to conclusions, but they are keeping a close eye on developments and staying connected with international health agencies.
It definitely feels like there's more transparency this time around.
Yeah.
Do you think that increased transparency helps to build trust and prevent the spread of misinformation?
Absolutely. Open communication from health organizations is crucial for fostering public trust.
Yeah.
It allows people to make informed decisions.
Right.
Based on evidence rather than speculation or fear.
You know, it's interesting how this whole HMPV situation has sparked such a diverse range of reactions.
Yeah.
Online, some people are dismissive, others are deeply concerned.
It's true.
It makes you wonder, how do we navigate the spectrum of opinions and filter out the noise?
That's the challenge we all face in the age of information overload.
Yeah.
We need to develop a critical eye.
Right.
Learn to evaluate sources and recognize the difference between evidence-based information and emotionally charged opinions.
Okay, so let's say someone is listening to this right now and they're feeling a bit anxious about all this HMPV talk.
Sure.
What advice would you give them?
First and foremost, I'd remind them that HMPV is not a new virus.
Okay.
It's been circulating for decades.
Right.
And most people experience it as a mild cold.
Okay.
For those who are concerned, though,
the
best course of action is to focus on preventative measures.
Okay.
The same precautions we learned during the COVID pandemic are still relevant here.
Okay.
Frequent hand washing, covering coughs and sneezes, and staying home when feeling unwell.
That's good practical advice.
Yeah.
It seems like a lot of the preventative measures for COVID-19 are applicable to other respiratory viruses like HMPV.
Exactly. It's about adopting healthy habits that can protect us from a range of potential threats.
Right.
Not just a specific virus.
It also highlights the importance of a strong immune system.
Totally.
What can we do on an individual level to boost our defenses and make ourselves more resilient to these kinds of viruses?
It's all about taking a holistic approach to health.
Okay.
A balanced diet, regular exercise, sufficient sleep stress management, and social connections all play a vital role in supporting a healthy immune system.
So in addition to those external precautions, we can also take steps to strengthen our internal defenses.
Precisely. It's about empowering ourselves to be proactive about our health and well-being.
Well, Tex Colley mentioned that there's no specific treatment for HMPV.
Yeah.
Are there any, promising research avenues?
That's a great question.
Or potential treatments on the horizon?
It underscores the importance of ongoing research and development in the field of infectious diseases.
Yeah.
While there's no magic bullet yet,
scientists
are exploring various avenues, including antiviral medications and vaccine development.
So while we may not have all the answers now,
the
scientific community is actively working to develop new tools to combat HMPV and other emerging viruses?
Absolutely, and that's reason for optimism. The pace of scientific advancement has accelerated in recent years.
That's great.
And we're constantly learning more about viruses and how to combat them effectively.
It's amazing how much progress has been made in such a short time.
It's truly remarkable, and it highlights the importance of investing in scientific research. And supporting the work of talented researchers around the world.
Okay, so we've talked about individual actions, but what about the bigger picture? What are some of the key takeaways for public health preparedness in light of this potential HMPV outbreak?
I think one of the most important lessons from the COVID-19 pandemic is the need for robust surveillance systems.
Okay.
that can detect and track emerging infectious diseases.
So it's not just about reacting to outbreaks.
Yeah.
It's about having systems in place to monitor and anticipate potential threats.
Exactly. It's about shifting from a reactive to a proactive approach to public health.
And another crucial element is like clear and transparent communication.
Absolutely. Health organizations need to provide the public with accurate and timely information.
Okay.
In a way that is easy to understand and act upon.
And that communication needs to be tailored to different audiences.
Yes.
Taking into account like cultural contexts and varying levels of health literacy.
Absolutely.
Right.
We need to meet people where they are and provide information in a way that is relevant and accessible.
Building trust is also paramount.
Totally. People need to feel confident that health authorities are acting in their best interests.
Right.
And providing them with reliable information.
Trust is definitely a two-way street.
It is.
It requires transparency and accountability from health organizations,
Okay.
as well as a willingness from the public to engage in informed dialogue and make responsible decisions.
You're right. It's a collective effort. We all have a role to play in safeguarding public health.
Another important aspect of preparedness is investing in research and development.
Yeah.
We need to continue to develop new diagnostic tools, treatments, and vaccines.
Right.
To stay ahead of emerging threats.
That makes sense. We can't just rely on the tools we have now. We need to constantly be innovating and developing new solutions.
The landscape of infectious diseases is constantly evolving.
It is.
And we need to be prepared to adapt and respond to new challenges.
Absolutely.
So it seems like preparedness involves a multifaceted approach.
It does.
Encompassing everything from individual actions to global collaboration and scientific advancements.
Absolutely. It's a complex issue, but one that we need to address collectively and proactively.
We can't afford to be complacent.
No, we can't.
You know, all this talk about public health preparedness is making me think about the role of governments and international organizations.
Okay.
What are their responsibilities in this context?
Governments and international organizations play a crucial role in coordinating global health efforts, providing funding for research and development, and ensuring equitable access to healthcare and essential medicines.
So it's about creating a global health infrastructure that can effectively respond to emerging threats, regardless of where they originate or who they affect.
Exactly. We need a system that is both robust and equitable.
Okay.
Capable of addressing both local outbreaks and global pandemics.
And that system needs to be built on a foundation of trust, transparency, and scientific evidence.
Absolutely. Without those core principles, any efforts to safeguard public health are likely to be ineffective.
It's also about recognizing that health is a global issue.
Yes.
What happens in one part of the world can quickly have ripple effects elsewhere.
That's a crucial point. We're all interconnected, and we need to approach public health with a global perspective.
So this HMPV situation is a reminder that we need to be prepared for the unexpected. And that preparedness involves a collective effort from individuals, communities, governments, and the global health community.
Couldn't agree more. We need to work together to build a more resilient and equitable future, where everyone has access to the information and resources they need to protect their health and well-being.
You know, it's interesting how we started this deep dive focusing on a specific virus, HMPV, but we've really expanded the conversation.
We have.
To encompass much broader themes about public health, global interconnectedness, and the importance of critical thinking in the digital age.
It's a testament to how deep dives can lead us down unexpected paths of inquiry and discovery.
And it highlights the importance of staying curious, asking questions, and being willing to challenge our assumptions.
Absolutely. It's through that process of exploration and critical reflection that we can truly expand our understanding of the world around us.
While there are still many unknowns surrounding HMPV and its potential impact, what are some of the key takeaways you would want our listeners to walk away with today?
Firstly, HMPV is not a new virus. It's been circulating for decades. And is usually associated with mild cold-like symptoms. Secondly, while there are reports of increased HMPV activity in China, it's essential to rely on verified information from reputable sources and avoid sensationalized or unconfirmed reports.
Good point.
And thirdly, we can apply many of the lessons learned from the COVID-19 pandemic to protect ourselves from HMPV and other respiratory viruses. This includes practicing good hygiene, staying home when sick, and staying informed about developments.
Those are excellent points. It's about taking a proactive approach to our health.
Yes.
Both individually and collectively.
Precisely. And while it's natural to feel concern about potential health threats,
sure,
it's important to approach these situations with a balanced perspective.
Okay.
Informed by evidence and guided by critical thinking.
Wow. It's amazing how much we've talked about.
I know, right?
We started with, HMPV in China, and now we're talking about like global health and mental well-being.
It's all connected.
It really is all connected. But before we wrap things up, I wanted to go back to something we talked about earlier.
Okay.
The lack of like treatment options for HMPV.
Right.
Tex Calais pointed this out, and it just adds another layer of like, complexity to this whole thing.
Yeah, for sure.
What are your thoughts on this?
I think it's a really important point.
Yeah.
And it shows us why we need more research in infectious diseases. We've made a lot of progress, but there are still so many viruses out there,
right,
including HMPV, that we don't have good treatments for.
Yeah.
Or vaccines.
So while we're, focusing on prevention and staying informed, there's also this need for science to, like, catch up.
Exactly. We need to be doing multiple things at the same time.
Okay.
Personal responsibility, public health initiatives, and scientific innovation.
It makes you wonder, like, what are the challenges in developing treatments for viruses like this?
That's a great question. I think one of the biggest challenges is just how different viruses are.
Okay.
And how complex they are.
Right.
They mutate so fast that it's hard to develop treatments that work against all the different types.
It's like we're always trying to catch up.
Exactly. It's a constant race.
Another challenge, I imagine, is just like the cost.
Oh, yeah.
And the time it takes to develop these new treatments.
It can take years. Even decades to develop a new drug or vaccine.
Yeah.
And it's incredibly expensive.
And then even if we do develop a treatment, there's the issue of access.
Yeah.
And can everyone afford it?
Exactly. This is why global cooperation is so important.
Yeah.
And a commitment to health equity.
We need to make sure that everyone benefits from scientific progress.
I agree.
So there are big challenges.
For sure.
But are there also like reasons to be optimistic?
Definitely. The pace of scientific innovation has really sped up.
Okay.
And we're learning more about viruses every day. For example, advancements in gene editing and mRNA technology.
Yeah.
Those hold a lot of promise.
Okay.
For new antiviral therapies and vaccines.
So even though we don't have all the answers right now, the future of antiviral research is looking pretty good.
I think so. And I think that's important to remember.
Yeah.
Especially when we're feeling anxious. About these potential health threats.
Yeah.
We're not just sitting around doing nothing.
Okay.
Science is constantly moving forward, finding new solutions and pushing the boundaries.
That's something to hold on to for sure.
It is.
We're not powerless.
No, we're not.
We have the power of knowledge.
Yes.
The power of innovation.
Wow.
And the power of human ingenuity.
That's a great way to put it.
I think that's a perfect place to end.
Yeah.
We've talked about a lot today.
You have.
Complex issues, big questions.
Yeah.
But I think we've come out of this deep dive with hope.
I agree.
And a new appreciation for, knowledge, critical thinking, and human connection.
I couldn't have said it better myself.
It's been great talking with you.
You too.
And a huge thank you to all of our listeners for joining us.
We hope you learned something new.
And challenged your assumptions.
And that you feel inspired.
To face these challenging times with courage,
compassion,
and a commitment to your well-being.
Until next time.
Stay curious, stay informed.
And stay connected.